Recording for this meeting has begun.
Hello, everybody, and welcome. My name is Jonah Begay with the Telebehavioral Health Center of Excellence, and this is the Zero Suicide Initiative. Today's session is a NOFO overview, and we're joined today by Lieutenant Commander Monique Richards. Before I turn it over to Lieutenant Commander Richards, here's a quick orientation to the layout that we have for this webinar. In the upper left-hand corner is for questions and comments that you might have for our presenter. You can type this in at any time during the presentation. Just know that once you do submit your comment or question, you won't be able to see it right away, but just know that the presenter and the host will be able to see them as they come in real time. Lower left-hand corner is the files for download. That's today's presentation in its PDF format. You can download this by clicking on the title itself that will highlight blue. From there, the Download Files button will become active. Click on that. It'll take you to a new window, a new tab, and then you can follow the prompts from there. For those of you using the latest version of Adobe Connect, simply hover your mouse over the title and select the download icon. It's a downward arrow into an upward bracket. Once you click on that, you'll be asked where you would like to save the file. Lower right-hand corner is the technical assistance. If you're having trouble seeing the slides or not hearing the audio very well, please let us know in that box there. Join us in the background. It's myself and Mary Toledo, and we'll try to help you out as best we can. With that out of the way, I'm going to go ahead and turn things now over to our presenter. Thank you.
Thank you, and good afternoon, everyone. My name, again, is Lieutenant Commander Monique Richards, and I'll be presenting today's webinar entitled Zero Suicide Initiative, Notice of Funding Opportunity Overview. So we are scheduled to go from 3 p.m. to 4 p.m. Eastern Time. As already mentioned, the webinar is recorded, and the PowerPoints are actually already available for download on the left-hand side of your screen. The purpose of the Zero Suicide Initiative is to improve the system of care for those at risk for suicide by implementing a comprehensive, culturally informed, multi-setting approach to suicide prevention in Indian health systems. This award represents a continuation of the Indian Health Service effort to implement the ZSI in Indian country. The intent of this announcement is to initiate a new or build upon a previously funded Zero Suicide Initiative efforts. So essentially, awardees could include previously funded projects or newly funded projects. Background. The purpose of this program is to improve the system of care for those at risk for suicide, again, by implementing a comprehensive, culturally informed, multi-setting approach to suicide prevention in Indian country. As I already mentioned, it is a continuation of IHS' effort to implement ZSI across Indian country. Funding announcement is for tribes, tribal, and urban Indian organizations as posted on the Federal Register on November 4th, 2021. And enclosed, you can see the links to access that information. And please reference Notice of Funding Opportunity listed here, HHS 2022 IHS ZSI 001. The application due date is February 2nd, 2022. Please note the application submission extensions will not be granted. Tribes, tribal organizations, and urban Indian organizations will need to submit through www.grants.gov by 11:59 p.m. Eastern Time. No extensions will be granted. Key dates to keep in mind. As mentioned, the due date is February 2nd. The internal objective review of all applications is slated to occur February 7th through the 11th, and the earliest anticipated start date is March 21st, 2022. And please keep in mind that a signed tribal resolution should be included in your application. date, which is February 2nd, 2022, and also a proof of nonprofit status is due with your application, which is due February 2nd, 2022. So the funding mechanism for this announcement is considered a cooperative agreement. A cooperative agreement essentially means that IHS will provide substantial technical assistance. There will be substantial involvement from the program official with all funded projects outlined as so. Funding amounts and estimated awards. So as stated in the NOFO, the total funding identified for fiscal year 2022 is approximately $2 million. Individual award amounts for the first year budget year are anticipated to be between $200,000 to $300,000. The funding available for competing and subsequent continuation awards issued under this announcement is subject to the availability of appropriations and budgetary priorities of the agency. Approximately 8 to 10 awards will be issued under this notice of funding opportunity, with a set-aside of up to 2 awards issued for eligible UIOs, Urban Indian Organizations. The period of performance in this cohort is for 5 years. Eligibility includes federally recognized tribes, tribal organizations, or urban Indian organizations. For more details for how that is defined, please go to the enclosed links on the slide. It's also referenced in the NOFO. The Zeocide Program Framework. The Zero Suicide Model is a highly effective framework for the creation of a suicide safer care that can be adapted to a range of health and behavioral health care systems. The IHS model is the Zero Suicide Initiative Cooperative Agreement Program that is a part of IHS's strategic focus on suicide prevention and care in American Indian and American Alaska Native health systems. So the implementation of this program will support the Indian Health Service mission to raise the physical, mental, social, and spiritual health of American Indian and Alaska Native people to the highest level, will be consistent with the tenets of the National Strategy for Suicide Prevention, and lastly, will focus on priorities of the National Action Alliance for Suicide Prevention. The 7 elements of the Zero Suicide Initiative represent what experts in the field of suicide prevention have identified as the core components of safe care for individuals with suicidal thoughts and urges. They represent a holistic approach to suicide prevention within health and behavioral health care systems. So in reviewing the NOFO, the ZSI 7 core elements include LEAD, which speaks to a system-wide culture of change committed to reducing suicide deaths. Train, a competent, confident, and caring workforce. Identify, which speaks to individuals with suicide via comprehensive screening and assessment. Engage, all individuals at risk of suicide using a suicide care management plan. Treat suicidal thoughts and behaviors using evidence-based treatment. Transition, individuals through care with warm handoffs and supportive contacts. And lastly, improve, policies and procedures through continuous data-driven quality improvement. Awardees will be required to collect data and have the means of systems in place to improve services. I would also like to add the theme of much of the work that we'll be doing in this program with the Zero Suicide Model is, again, It's a specific model that was created for Native American and Alaska Natives. The framework for culture, it gives attention to the humility necessary to provide safer suicide care that is resonant with those receiving it. No one group is homogeneous in all aspects. Even within tribes, there is great diversity, and this diversity must be acknowledged in order to respond to the need for safe, culturally appropriate suicide care that is delivered in thoughtful ways. Each applicant must describe how they plan to implement the following core elements of this program in their project narrative and incorporate culture within the approach to each of the 7 elements. In the required optional allowable activities, we have provided you with resources that will support each core element. Now transitioning into the required activity sections of the NOFO, it states that in addition to the 7 elements that was just mentioned, the following activities are also required. The applicant that receives the funding should seek IHS's approval for key positions to be filled. Key positions include, but are not limited to, the project director, project coordinator, and evaluator. They must consult and accept guidance from IHS staff on performance of programmatic and data collection activities to achieve the goals of the cooperative agreement. And lastly, must maintain ongoing communication with the IHS staff, including 1 call per month, keeping the federal program staff informed of emerging issues, developments, and problems as appropriate. In addition, you must invite the IHS program official to observe and provide feedback to policy steering, advisory, or other task forces. Maintain ongoing collaboration with the IHS VSI Technical Assistance Coordinating Center, the Suicide Prevention Resource Center, and the National Suicide Prevention Lifeline, and provide the required documentation for monthly and annual reporting data. So now that I've provided some of that contextual information that was included in the NOFO, the background and the requirements as such, we're going to transition into how to prepare your application. So for tribes, tribal organizations, and urban Indian organizations, please note you must register on grants.gov. That is required. If any entity is not registered, please note that this can take up to 15 business days. So please verify your registration and get registered right away. Registration and other information can be found at the enclosed link. You want to download the application package and detailed instructions for funding opportunities by visiting the above link. You want to click the tabs, Applicants, Apply for Grants, get the application package, and enter the CFDA number listed, hashtag 93.654. Transitioning into the project narrative. The project narrative of the application is the main component of the application, which describes the proposed scope of work, must be single-spaced, and shall not exceed 30 pages. The page limit does not include the cover letter, table of contents, abstract, statement of need, standard forms, tribal resolutions, budget and budget narrative, local collection plan as known as the LDCP, and or other appendix items. Reminders for the project narrative. Applicants previously funded by the ZSI must report on the status of their goals and milestones in this section of the program narrative. If goals and milestones were not achieved by those applicants, they are expected to provide a clear explanation of the barriers that prevented the achievement of the previous goals/milestones. Please keep in mind that all applicants are required to address all 7 of the key elements listed on the NOFO. Again, just want to reiterate that please read this section very carefully and make sure that you fully respond to each item listed under each part. I would also add that upon your review, you will notice that the various sections are throughout the NOFO are organized around the 7 core elements. Budget and budget narrative. Applicants are to submit a budget and a budget narrative for project year 1 only. The budget and the budget narrative must include a line item budget with a narrative justification for all expenditures, identifying reasonable and allowable costs necessary to accomplish the goals and objectives as outlined in the project narrative. The budget and the budget narrative may not exceed 4 single-space pages for both documents combined. Application and submission information. Please note the mandatory documents for all applicants. Listed on the slide includes tribes, tribal organizations, and urban Indian organizations, 501c3 certificate, if applicable, biographical sketches for all key personnel, contractor/consultant resumes or qualifications and scope of work, disclosure of lobbying activities if applicant conducts reportable lobbying, certification regarding lobbying, known as the GG lobbying form, copy of current negotiated indirect cost rate, organizational chart, that's optional, the documentation of current Office of Management and Budget financial audit if applicable. So please review that carefully. Tips for preparing a strong application. Succinctly address and answer all questions listed under the required application components and place all responses and required information in the correct section, or they shall not be considered or scored. Please adhere to the page limitation requirements for the proposal listed in the instructions. Documents that exceed the page limitation requirements will only be reviewed up to the specified page limitation. Example, the project narrative may not exceed 30 pages. The following narrative pieces will assist the objective review, known as the ORC, in becoming familiar with the applicant's activities and accomplishments prior to this potential award. Tips for preparing a strong application. Additional tips include keep the review criteria in mind when writing the application. Applications will be scored based on the information that is contained in the application package. Be sure the application forms and the information in your narratives are complete, clearly written, and address the criteria that will be used when the application is reviewed. Do not assume the reviewers are familiar with your organization, service area, barriers to health of care, or healthcare needs of your community. Start preparing your application as early as possible. Allow plenty of time to gather required information from various sources. Additional tips include be concise and clear. Make your points understandable. Provide accurate and honest information, including candid accounts of problems and realistic plans to address them. If any required information or data is omitted, explain why. Make sure the information provided throughout the application is consistent. Also, ensure your budget reflects the proposed program activities. Use the provided templates. Provide all of the information requested in each section of the templates. And be sure to follow the instructions at the beginning of each template. In addition, follow formatting guidelines when preparing narratives. Be aware of the page limitations for each section if applicable. Adhere to the spacing requirements, allowable size font, and page numbering requirements. Carefully proofread the application before submission. Misspellings and grammatical errors will make it hard for reviewers to understand the application. Carefully review a copy of your application package to ensure accuracy and completeness. Print out the application before submitting. Review it to make sure it is complete and all required documents are included. Now here enclosed are the templates, and if you have not had an opportunity to download these yet, it's my understanding that these two, the last two links, the Zero Suicide Data Elements worksheet and the Zero Suicide Work Plan template, those links are down currently, and hopefully we can get those back up as soon as possible. But if you're having any problems, locating any of these templates, my contact information is listed on these slides. I'll be happy to assist you. But I do just want to make note that I am aware that these last two links those links are not currently active. So we're going to do our due diligence to get those active as quickly as possible. And here, right here, the last link that you see, the templates can be obtained on the IHS.gov funding announcement page for ZSI. So now let's transition into the selection criteria. Please note that all applicants will submit the same application and undergo the same eligibility and selection criteria. Points are assigned to each evaluation criteria, adding up to a total of 100 points. A minimum score of 70 points is required for funding. The statement of need is worth 10 points, implementation approach and work plan 30, organizational capacity 30, data performance assessment and evaluation 25 points, categorical budget and budget narrative is 5 points, for a total of 100 points. Now, as you probably have noticed, for those that are familiar with the grant writing process, the project narrative, what we're asking for and what we're going to evaluate, that essentially mirrors each other. So what we're asking for in the project narrative and then what we're going to evaluate is the same thing. So the statement of need, again, is worth 10 points. What are we asking for here? What are we going to be evaluating here? So the degree to which the applicant's description of the service area target population demonstrates the need for a system approach to suicide care within the health and behavioral health care system. Also, how well the applicant describes the unique characteristics of the service area and population and system barriers and gaps that impact the delivery of comprehensive suicide care. Implementation approach and work plan, 30 points. In this section, we want to see a viable plan to address each of the 7 elements of the Zero Suicide model and the required activities in a systematic, measurable, and interrelated manner. We want to see that you have developed a strategy to collect and analyze the application of evidence-based practices to screen, assess, and treat individuals' use of culturally informed practices and activities. We want to also see a clear description of strategies to engage the highest levels of leadership and broad cross-section of the behavioral healthcare system in order to develop organizational commitment, participation, and sustainability. The identification of how all of the departments, units, divisions will be involved in administering the project. In addition, within the implementation approach plan section, we're also going to be looking at how the applicant addressed how continuity will be maintained if or when there is a change in the operational environment to ensure project stability over the period of performance. Organizational capacity, 30 points. The extent to which the applicant describes experience with the Zero Suicide model or similar collaborative efforts. The extent to which the applicant describes experience with the capacity to provide culturally informed practices and activities for specific populations of focus must refer to the tribal resolution. Identification of how all departments, units, divisions across the healthcare applicant organization currently or plans to collaborate with other organizations and agencies to provide care, including critical transition of care, and also describe the resources available to implement and sustain the proposed project, listing all staff positions of the project. In this section, we're also going to be looking at how the applicant demonstrates the successful project implementation for the level of effort budgeted for the project director, project coordinator, and other staff. We want to see position descriptions as attachments to the application. Describe the function within each position providing services in suicide care, behavioral health and primary care, and other healthcare services, quality and process improvement, and related work within the community and communities. In addition, applicants previously funded, as mentioned, by the IHS ZSI must report on the status of their goals and milestones in this section for the program project narrative. Again, if the goals and milestones were not achieved by the applicant, they are expected to provide a clear explanation of barriers that prevented the achievement of previous goals and milestones. Data collection, performance, assessment, and evaluation is worth 25 points. In this section, the applicant should clearly indicate their ability to collect and report on the required performance measures specified in the data collection and performance management section. It should provide a clear, specific plan for data collection, management, analysis, and reporting. Should provide a description of your plan for conducting the local performance assessment as specified above and evidence of your ability to conduct the assessment. Should also include a description of the quality improvement process that will be used to track progress towards your performance measures and objectives. Categorical budget and budget justification is worth 5 points. In this section, we need to see evidence of reasonable, allowable costs necessary to achieve the objective outlined in the project narrative, a description of how the budget aligns with the overall scope of work, and also note that the budget and the budget narrative template worksheet to support your responses in this section is available for download on the link provided on the IHS Funding Opportunities webpage. Multi-year project requirements. Please note, since this project is projected to be a multi-year project, applicants must include a brief project narrative and budget. It says 1 additional page per year addressing the development plans for each additional year of the project. This attachment will not count as part of your project narrative or the budget narrative. Additional documents and other attachments. Displayed are additional documents to include the work plan, logic model, and the timeline for proposed objectives, position descriptions for staff, consultant or contractor proposed scope of work, and letter commitment, current indirect cost rate agreement, organizational chart, map of the area identifying project locations, additional documents to support the narrative such as data tables, news articles, etc. Resources. Please visit the ZSI webpage for the most current up-to-date information, as I already mentioned. Also, in preparing your application, if you're not familiar with the 2012 National Strategy, the Surgeon General's National Strategy, you can obtain that at the enclosed link, which is bullet 2. Also, applicants are encouraged to visit the Zero Suicide Suicide Prevention Resource Center for various zero suicide strategies and tools required for the grant program. And also, applicants are encouraged to visit and review the Joint Commission document listed on the last bullet. So today is the second technical assistance webinar. We've also been having ongoing virtual office hours. Also, there's also contact information that is available on the funding announcement page. It's also included here. If you have some fiscal questions, let's say you're developing your project narrative and you're not sure, oh, can this grant pay for this? I would strongly suggest you reach out to Sheila Miller, who is the grants management specialist for the program, for any fiscal related questions. If you have any issues related to grants.gov, please contact Paul Getty. He is the grant systems coordinator. And if you have any programmatic questions, after you kind of digest today's webinar, review the slides, and maybe review the NOFO again as you're working through it to meet the deadline, you can certainly reach out to me. My contact information is listed here. So I'm going to pause, and if you have any questions, please type them into the chat box, and I will answer your questions. So the first question says, yesterday I cannot download some of the pieces of the application from the website. Is there a technical problem? Yes, as I mentioned, there are some issues going on with a couple of the documents, and I was just informed that the links are fixed and live on the website. So if you had any issues earlier today with accessing the links, please try them again. And again, certainly if you're having any technical challenges, you can certainly feel free to reach out to me. But the links have been updated as I've been conducting this webinar. They're fixed and live on the website. I want to thank you all for joining today. I'm going to hold on the line. If there's additional questions, please type them in the chat box. We look forward to receiving some strong applications. We're so excited to generate this much interest today. I want to wish everyone a great, prosperous new year. And for those that are successful with being awarded this next round of funding, I look forward to working with you as I'll be the program official for the next cohort. So we are at 3:37. We still have some additional time left, so I'm just going to hold here. And again, if you have any questions, please type them in the chat box. Again, as a reminder, if you would like a copy of the slides, they are available for download on the left-hand side. Again, the slides can be downloaded in the lower left area of the screen. So we are steadily approaching the deadline, February 2nd. We have 2 more weeks of virtual office hours. Again, you can certainly reach out via email or phone as you're working through certain components of the application, and I'll be happy to address your concerns at that time. Again, I'm going to hold on the line for 2 more minutes, and then I'll conclude today's webinar.
And this is Jonah Begay. As a reminder, those questions and comments can be put in the upper left corner of the screen. Thank you.
Okay, I think I see a question that came in a different box. It says, on most IHS grants, the application asks to list the cities, states, and counties our program serves. Is it best to list all towns, counties, and states, or by IHS service area? That's a great question. I would suggest you really focus on, the area that you're serving, your catchment area. So you're the best person to be able to make that determination. If you want to talk a little bit more about that offline, please reach out to me. But that is at your discretion, to determine how granular, you want to present that information. But I think as narrow focus as you can make it, the better. But certainly reach out if you have more questions regarding that. Again, please type your questions in the Q&A box on the left-hand side. Okay, it looks like we have one final question making its way over to the chat box.
Lieutenant Commander Richards, it appears we have 2 more questions in the Q&A box as well.
Thank you. So the next question says, I was wondering about counseling service. Do we have to have them? The point of this program is to implement this CSI model within your current health care system. So, if you're in a primary setting, behavioral health setting, for you to be able to infuse this model within your existing healthcare system. So, a lot of systems are integrated. So if you want to talk more about that, please reach out. But we don't have any, we don't have a menu of services that you have to have already in place. I hope that answers your question. The next question says, if our program is registered on grants.gov for another funding opportunity, do we register again for this funding opportunity? That is a great technical question. I would suggest you reach out to Paul Getty to get clarification on that, and maybe the grants.gov help desk, because I don't want to steer you wrong there. That's a technical question that I can't answer. The next question. Okay. Okay, I think I answered it. Okay, everyone, here again is my contact information. Again, if you're working through the application and you just have a quick question that you want to answer, I work on Eastern Standard Time from 7 to 4:30, so please feel free to reach out. Again, thank you all for joining today, and I think we have one more question that came in the queue. Let's see what this says. It says, can you touch on the advisory committee and the level of oversight required? I believe this grant requires a level of collaboration. Yes, it does. But again, if whatever's listed in the NOFO, that is what's required. So I will also add that there will be technical assistance provided by the Indian Health Service and a technical assistance provider that will give you more in-depth details about, what that could look like on the ground. But I would encourage you to just focus on what is already indicated and what is provided in the NOFO. And we will definitely be for those that are awarded, we will be providing additional technical assistance as it relates to different components of the actual implementation of the model. And of course, if you want to talk more about that offline, you can certainly reach out to me. So thank you for your question. All right. Thanks everyone for joining today. This concludes today's webinar for the ZSI NOFO overview. Over and out. Thank you.